Hi everyone, my name is Morgan Rudy. I'm a full-time college athletic trainer in the state of Maine. A question that I often get asked by my athletes is what is the best diet or nutritional recommendations to prevent muscle cramps for college athletes? Just as a quick preface, in the state of Maine, it is outside of my scope of practice to offer any advice, assessments, goal setting, or counseling as it relates to nutrition. So for the purpose of this discussion, the nutritional guidelines that I discuss are summarized from the research that I have found, and they're not meant to be specific recommendations for athletes. If an athlete wants specific information about their nutrition and what's best for them, I would recommend that they reach out to a sports nutritionist for further information. So what does the actual literature say about muscle cramps? According to Schwellness 2009, muscle cramps are defined as, quote, painful, spasmodic, involuntary contractions of skeletal muscle that occurred during or immediately after exercise. Schwellness 2009 continues to discuss that there are a couple possible theories surrounding how muscle cramps occur. First, and the likely most common and well-known theory is due to electrolyte imbalance or depletion and dehydration. However, the evidence to support this theory is anecdotal and is hard to prove with randomized controlled trials. So most of those studies have looked at that are mixed and inconclusive. The second theory discussed by Schwellness 2009 states that that wonders if there's an altered neuromuscular control. So the hypothesis discussed how with repetitive exercise, increased intensity, duration, there's a decrease in muscle energy, which leads to fatigue. That fatigue then leads to the excitatory principles and inhibitory muscle tissues being affected, which then leads to neuromuscular control issues, which is then thought to induce the muscle cramp. However, again, the research in this area is very inconclusive, so it makes it difficult to determine any kind of treatment or prevention plan because we don't really know how muscle cramps are caused. There have been a couple interesting studies in this area. The first conducted by Zhang and colleagues in 2005. They sought to look at the role of hydration and electrolyte supplements during exercise as an attempt to prevent muscle cramps. Zhang and colleagues 2005 had 13 college-aged men and asked them to complete 2 trials. In both trials, they were asked to complete a calf fatiguing protocol and attempt to induce a cramp in the calf muscle. One trial, the men were not allowed to consume any fluids, and in the other, they were asked to consume a carbohydrate electrolyte beverage with added sodium chloride. The study concluded that drinking the carbohydrate electrolyte beverage may slow down the development of cramps, but not and allow the athlete to participate longer without inducing a cramp. However, dehydration does not appear to be the only cause because 69% of those participants experienced a cramp while they were hydrated. A second observational study was conducted by Stofan and colleagues in 2005 on Division I NCAA football players. This study compared football players that had a history of muscle cramps with those that had never had cramped. They examined their sweat losses and sweat rates, specifically looking at sodium and potassium concentrations. Stofan and colleagues 2005 found that those athletes with a history of cramping lost twice as much sodium in their sweat when compared to non-crampers. Stofan and colleagues 2005 concluded that, quote, large acute sodium fluid losses in sweat may be a characteristic of football players with a history of cramping. Again, that's not saying that sodium losses directly causes cramps, but that may be where things are heading. Again, because the research is so inconclusive with regards to how muscle cramps happen, it makes determining a prevention plan difficult. However, it is recommended that proper nutrition and hydration before, during, and after can help. The following are general guidelines for the average athletes as discussed in a position statement by Thomas and colleagues in 2016. So again, the exact amounts need to be individualized and unique to their specific sport and period in the season. However, speaking in general terms, a well-balanced diet for the general athlete may help prevent a muscle cramp. A well-balanced diet includes carbohydrates, proteins, fats, and proper hydration status. For carbohydrates overall, it's recommended that 6 to 10 grams per kilogram per day is what's best. And then leading up to an event, so about 60 minutes prior, you should have 1 to 4 grams per kilogram of carbohydrates. It states that fruits and veggies are high importance, and you want carbohydrates that are low on the glycemic index. For proteins, you're looking at 1.2 to 2.0 grams per kilogram per day. You want high quality proteins, and you're looking more for whole food proteins first, and then if those are not readily available, then protein supplements can be used. For fats, you're looking at less than 10% of your daily intake should come from saturated fats. For hydration, throughout the day, you want to take your body weight times that by 0.5, and that should be about, in your fluid ounces, how many fluid ounces a day you should be consuming of water or other juices or other beverages. It's important to start a bout of exercise at a good state of hydration. And so it's recommended that 2 to 4 hours before exercise, you should be consuming 2 to 4 milliliters per pound of body weight. In vaguer terms, know that you're at a good hydrated state. Your urine should be about a pale yellow color. It is also thought that sodium can help with fluid retention. So a saying that always kind of stuck with me from my undergraduate education was water follows salt. So if you have, the more sodium you have in your body, the more likely the water will be drawn into the muscles and to the tissue, and you'll be able to retain it. So during exercise, in terms of hydration, it depends on your individual sweat rate, depends on the climate, depends on the intensity of the exercise. But typically most athletes will consume about 0.4 to 0.8 liters per hour of water or sports drink or something. Again, athletes should drink if they're thirsty. Be careful not to overhydrate, because overhydration can lead to further complications. It's important that coaches offer water breaks and give an athlete ample opportunity to stay hydrated throughout a workout session. Again, post-exercise fluid intake should be dependent upon, again, how hard the exercise bout was, the intensity, how much sweat they lost. So it's suggested that 1.25 liters to 1.5 liters should be consumed for every 1 kilogram amount of body weight that was lost during that exercise bout. So for an athlete, they should weigh themselves before and after exercise to determine how much they lost, and then that can be directly calculated for how much they should consume after exercise. For pre-event meals, generally you're looking at low fat, low fiber, and low to moderate protein. So this is why they say low fat, low fiber, because it's less likely to cause gastrointestinal problems. Liquid meals can be a good option for those athletes that get pre-participation nerves. It's also recommended that athletes limit their alcohol use. Alcohol is a diuretic, and it will actually could further dehydrate the body rather than help. It'll also affect athletic performance a few days after. And it also has a negative side effect on recovery. So it is recommended that athletes do not consume alcohol or consume alcohol in moderate amounts. So in conclusion, cramps are hard to prevent and they're hard to control. But with proper nutrition, hydration, it can be shown to help. In the past, I have had athletes that have had a history of cramping, issues with cramping. I have referred them to our sports nutritionist, and they developed a plan in place to help with pre-participation meals and nutrition during competition and then post. And that has been shown anecdotally, those athletes have done much better with their participation in terms of cramping.